Hello, hello, hello. Welcome to Al Stock Trades. How's everyone doing today? I hope you guys are enjoying your Friday. I hope it's a blessed one. And so in this video, we're going to do a lot of discussion. We're going to watch this video. We're going to react to it, give my thoughts and opinions here. This is, by the way, the chief medical officer testifying before Congress for Clover Health. We're also going to go ahead and talk about how she's also the president-elect for the Iowa Medical Society, which you can find here. Here she is right there. And then we're also going to go ahead and take a look at her testimony on paper. And then we're going to go ahead and just kind of talk about why is this significant. Then we're going to talk about this release that Clover has had. We already know about the new CFO of Medicare Advantage, but we're going to go ahead and just talk about additional quotes that they have in here. And we're going to go and give my thoughts. Now, before we go ahead and start the video, I'm just going to go ahead and disable the share screen here. And I'm going to go ahead and share the audio version because that's just how the system we're doing. That's how we have to do it. So now this should give me the audio. Good. Marcos, I don't know what 27 means. You're going to have to tell me. All right, guys. So let me just give you first off. I want to first off thank you guys for coming here and watching our channel and, taking time out of your day, definitely means a lot. So thank you so much for that. Also, I do want to comment on a couple of exterior things around Clover Health. There's been increasing dark pool data. Sorry, 27. What? Jackson Hobbs. What does 27 mean? Can someone explain to me? Am I wrong? I don't know. Okay, sorry. Yeah. So what I wanted to essentially focus on here is there's been a lot of dark pool increases regarding the stock price. And I do have to admit, I have been seeing a lot of negative comments. Oh, 27 is my buy price. How long do you think it'll take to get my money? Oh, 28. Yeah. I'm so confused with the numbers, guys. I feel like I'm living in the Matrix. What's going on? Can you guys explain to me what's going on? Okay. So there's been a lot of increases in dark pool. A lot. Okay. And for some reason, I don't know why, but there's been a lot of negative comments. Why? I kind of don't know why. But there's been a lot of abnormal negative comments lately. Really abnormal. I'm getting negative comments everywhere. And people are saying, just sell it. It's a joke. Just give it up and just sell it. Just give it up and sell it. Give it up and sell it. I'm getting a lot of just give it up and sell it. And I'm curious, like, what's changed? Like they're going to be profitable in terms of a non-EBITDA case. Still, I don't, they're going to get hopefully closer to free cash flow. We're going to see. That's what I'm expecting. I feel like there's just this new resistance, and every time the stock prices drop, this new resistance comes online, right? Oh, I just saw a good opportunity and took it. Okay, yeah, you guys are effing with me. Okay, you see, Marcos, you see what you did there? You started a whole thing, right? Yeah, I'll do it too now. Right, here's my comment. Okay, 27. All right. So in any case, I have been noticing this, and it's been very funny. I laugh at it because I don't know what people are doing with their lives. But again, healthcare is boring. No one wants to be in the stock because it's boring. Who wants to be in healthcare? Right? Healthcare is so boring. In fact, if you go ahead and go on Webull and type in Oscar went up like 5x. And then it's like still not a lot of people are there. It's just people don't really think healthcare is fun. And these are the types of companies I like. Energy Transfer, but this one has a little tech side to it. And I think if they can operate in a way, especially with their PPO plan, which I think is far superior than HMO, I think they have something here, right? So let's go ahead and talk about Dr. Christina Taylor. And we're going to first listen to her, and then we'll go from there. Okay, so I'm going to go ahead and increase the volume, and then I'm going to mute myself. And let me know if you guys hear it.
I'm Dr. Christy Taylor, and I'm an internal medicine physician from Iowa. I've practiced for nearly 20 years. I started out in a...
Okay, let's start off right there. Literally within like 7 seconds, I should have her teach me how to do YouTube, right? She's given so much information, okay? She's an internal medicine doctor, okay? And she's been practicing for 20. That's all I hear. 27. We should make that song, 27. Can you do something for me? That Drake. Or I think that's the number. But yeah, she's an internal medicine doctor. She's been there for 20 years. So she's obviously credible, and she's going to be the president-elect of a Iowa Medical Society. Listen, guys, being a president-elect, that's a big deal. Okay. Again, I'm in healthcare, right? I was the vice president of the American Association of Neurological Surgeons for the Tucson chapter. I was also I'm also the CEO of this new nonprofit, Global Neurosurgical Alliance. It's very difficult to be and create something where you're leading a lot of physicians, right? So she obviously has credibility. Okay, so that's really good for Clover Health.
Physician-owned multi-specialty clinic, the Iowa Clinic, and I was their
Okay, so she, physician-owned clinic, which is good, which is exactly what Clover Health is trying to target with their potentially non-insurance SaaS-like business to supply their softwares to physician-owned folks. So I'm giving you this is a good breakdown. Okay.
first chief quality officer. And then I was the chief medical officer, McFarland Clinic, where we served both rural and urban patients. And throughout this time, I've also served as the medical director of a multi-state ACO. So in my career, I've been deeply involved in transitioning our organizations from fee-for-service to value-based care. I've been blessed to work at organizations that historically delivered exceptional care, but even we had to change our focus from that of volume to patient access and coordinating care to deliver the right care to the right patients at the right time.
So I want to just give you some of my experience here because that's why you guys are here. So when I was doing my family medicine rotation, I was actually, luckily, I actually was doing it in a private practice. Kind of got to see private practice in terms of how it's run. There's some cool things that I liked about it, like you being your own boss and you setting kind of the standard of care. But there's other things I didn't like about it, particularly that the guy just didn't choose to see traditional not traditional Medicare, but like Medicaid folks that are really off of the rails in terms of being poor and everything. That's the population I like to serve, right? But I'm not saying all private practices are like this, just the one I was in. But when I was in this private practice, and it's a big private practice, this is a big one. I was with I don't want to say his name. He didn't, he doesn't want to be on this video. I haven't asked him, so I'm not gonna put his name out there. But I was sitting with him, and he was the lead physician, and I was shadowing him, and I worked with him for a good 8 weeks, which is a lot, for medicine, right? That's 2 months. And I sat with him in multiple meetings where they were discussing coding and discussing kind of the value-based care shift. Now, not ideally, but before there was just a volume base where the more patients you see, the more money you make. The thing is, medicine has changed. Like the healthcare system has changed because, if I'm incentivized to basically see as many patients as possible and see like a lot of patients, then okay, I'll see a lot of patients. I won't basically help them. I'll just listen to them. Here, take this, take that. But, obviously these types of healthcare, increases medical error, misdiagnosis, doesn't really get to the root cause of the patient's problems, doesn't really provide an accurate HPI to basically formulate a good high probable differential diagnosis and ultimately a proper assessment and plan to give to your patients. This old healthcare model was crap, and I feel like now we're moving more towards a Mayo Clinic model, which I actually have experience with. I was at Mayo Clinic for a little over a year in Rochester, Minnesota. I was able to publish with them, and now one of my books are in their libraries. And it's more of like, let me take care of you, let me listen to you, let me provide you value. So this transition is going to there, and a lot of physicians are not, they don't have the necessary tools to be able to provide the value, given that it's just healthcare is so broken. So she's basically integrating the shift, and I do see the shift. A lot of programming, a lot of coding. Now, what is value-based care? Well, value-based care dictates that if a patient doesn't take their diabetes medication, it's the doctor's fault. Again, I know a lot of doctors don't like that, but the doctor needs to basically convince the patient that they need to take their medication. How's a doctor able to know this? Well, Clover added a couple of things, medication adherence, right? Again, listen, guys, Wall Street, a lot of, people that, are trading the very sexy stocks right now. Listen, I've been through this time and time after again. This healthcare company, I was actually surprised it was getting a lot of love in the beginning, but that was just because 2020 people were at home. You know what I mean? In that era. But I'm telling you guys, the Clover is actually solving some real-time issues right now that physicians have, right? And if by Clover solving this issue with the whole medication adherence schedule, it actually provides a check mark in value-based care, which will ultimately increase reimbursements and save patients money, save the healthcare system money, and save taxpayer money, which is what we're going to get into regarding the Senate community hearing. This obviously they're both benefiting from this. Clover's benefiting, we're benefiting as investors, and the senator's benefiting because he gets to decrease taxes and he gets to get his voters like that and to increase his voting. So everyone's benefiting here, which is the types of policies I like to support. Okay, so here's this. Okay, so now that we know that it's value-based care, what else are the issues? Okay, let's say for example, a patient basically gets discharged, or patient comes to your office and then all of a sudden goes to the hospital. Well, that's bad on you. Why? Right? Clover Health. This was like a paper in 2018, I believe, in their median developmental code analysis. They basically said that their Clover Assistant can predict the likelihood when someone is going to go to the hospital. This is very valuable for home-based care because, again, going to the hospital is more expensive than going to Beverly Hills, okay? Right? Or going to Mar-a-Lago, right? I don't know about Mar-a-Lago. Maybe that's pretty expensive, but I think healthcare is more expensive than Mar-a-Lago. Let's say that, right? So being able to predict that ultimately basically saves you time and money. Okay, so there's that perspective. What else? When I was in that meeting with those physicians, they were talking about coding. They're talking about blood pressure, medication adherence, all these different types of things. What else? Weight, BMI, all these different types of things that are preventable. And I'm actually happy the government's pushing this because it really is challenging doctors to actually provide value-based care. And doctors need to go ahead, and I get it, man. Payments and medical schools increasing, debt is increasing. There's a lot of there's a lot of issues with healthcare in terms of doctors are coming out with $200,000-$300,000 in debt, and if they choose primary care, then they're not really going to make as much money as specialists, which basically pay for procedures. And then, medical schools are solving this issue by providing, free tuition for folks that are committing to primary care. But, what I'm basically trying to say is, as doctors that are frustrated with trying to provide value-based care, my humblest regards to your all, suck it up. Okay. Suck it up. There's doctors in different parts of the world that are getting paid 20-30% of what you're making. Right. I know that it's hard, and to provide, care like this. But when you have the most highest spending GDP on healthcare, and you have a, country that's ranked, like a third world country in terms of life expectancy, next to, like top 35 or top, in the top 40s, that's, you have to take blame of that. Right. And I get it. I know you're overworked. I know but that's the job of a physician. Suck it up and work hard. Okay. Luckily, as you work hard, there are people like Dr. Taylor that are going to make your life easier by decreasing administrative burden. Now, again, that's why I'm going into neurosurgery. I'm a masochist. There is no work-life balance. There's work-life integration. And that's just how I work, right? But it's up to us, future doctors and physicians, to just suck it up and take care of these beautiful people around her and the beautiful society. But again, I'm going to get away from that. Let's focus in on the video here. Just want to give you my perspective, okay?
And now I'm the Chief Medical Officer of the Value Division of Clover Health, an organization which brings support and actionable patient information to primary care providers. So in all of these settings, a fundamental aspect we've focused on is the critical role of primary care providers in coordinating care. Patients who see primary care physicians absolutely have lower overall total cost of care. In my clinic, we focused on both patient access and engagement. We actually improved quality of care and had significantly lower costs, and we were successful in our value-based contracts. We received shared savings every single year. The most meaningful results, however, were what we saw in our patient outcomes, both in prevention and in disease management. And most of this work was done by primary care physicians. And then we collaborated.
Exactly. So, you're seeing how she's hitting the dots that I've been basically on: decreasing costs and better outcomes. And that's ultimately the best possible case, right?
With other groups around the country to share best practices and challenge ourselves further. Our preventative care increased things such as vaccines and cancer screenings. And with actionable data and additional personnel, we manage chronic disease patients better, such as those with hypertension and diabetes, to help them get and stay in better control. This resulted in healthier patients and fewer ER and hospital admissions. But along the way to value, several investments were necessary. We added additional personnel such as care managers, plus the technological and analytical resources to make the data actionable.
And that's Clover Assistant, the technological data to make basically the data accessible. Again, when you listen to this doctor, you know, I've been around the block, guys. I have by the time I graduate medical school, I'm going to have 5 degrees. I've been around the block. When I look at this person, she knows what she's talking about. Okay, it's very clear. Okay, and that's why she's the president elect. This lady is a top doctor. This is the type of student that did really well in medical school. That was most likely part of the top 50% of her class. Okay, uh, um, the way she's talking, the way you know, you can tell she knows what the hell she's talking about. And Clover really, chose the right person for the job, especially in Iowa. A beautiful part is this Clover Assistant, I think, is only gonna. It's not really gonna spread. I thought at first, and it was my mistake, that this is gonna spread by the patients. And there might be some contagion in terms of patients spreading, in terms of, oh man, I really like Clover Health. But I think this is going to spread by the doctors. I think this is going to be doctor driven, because doctors need to basically take back medicine. Doctors need to basically say, you know what, we need to be in charge. We're the doctors, we're the pilot. We're going to tell you how things go. I mean, just look what happened to Boeing, right? Business people stepped in, and it's literally Boeings are flying off of the sky with their engines burning. Okay. You need doctors to run a doctor business, and you need engineers to run a flying business. Okay. Aviation business. All right. Let's continue going.
And these resources are outside the scope of what we would call traditional care or regular practice. For example, we put people and processes in place so that we could get real-time hospital discharge information, so that we could reach out to patients during these vulnerable times in their.
Again, she's mentioning the Clover Assistant. They're getting real-time hospital admission. Again, Clover Health is the insurer, right? They're able to get this data, right? Because every time the patient goes to the hospital, God forbid, and hopefully this limits for the beloved patient, but Clover is able to get this data, and this data is actionable. And instead of basically overprescribing and redoing tests that have already been done that ultimately charge the Clover Assurance healthcare provider more, and let's say, for example, a third-party provider, let's say Humana, if they use the Clover Assistant, let's say, for example, then they're ultimately going to, I'm not saying they will, I'm just saying if a third-party insurance provider uses it, they're going to say, oh, we've already done this. Okay, the doctor says, oh, I've already, Dr. X and Y and Z has done this. Let me pull this data and let me get this data. Why order the test again? It's going to basically give my patient an unnecessary prick. It's going to give unnecessary time and waste to spend, and then tax money spent. It's going to waste time and money and pay, ultimately subjugate the patient for more testing, and ultimately increase the possibility of false positives to increase. Let's continue.
Their healthcare. And it required both timely data and care managers in place to actually result in true care coordination, so that we could have good follow-up, reduced medical error, and readmissions prevented. So across multiple.
Sorry, my apologies there. I forgot to unmute it. What I was basically saying is readmission rate. Readmission rate is important to look at. I recently published a paper that looked at readmission rate with medical respite centers. And for folks that don't know what that is, if I go to the hospital today, and let's say I get discharged tomorrow, if I go back to the hospital within 30 days, that counts as a readmission rate. Does that make sense? So Clover's decreasing that. Insurance companies look at that for the quality of care, value-based care. Why is the patient coming back to the hospital within the 30-day time frame? It means the healthcare was not superior. So that's good. They're basically focusing on this and transitioning this. And I love that they're doing this, because ultimately it puts the needs of the patient first. Let's continue.
Multiple organizations, I've seen the positive impact that primary care providers who actually focus on value have made. With the right resources, we have safer, better care at lower cost. But despite these successes, significant challenges remain, namely those of investment, administrative burden, and lack of predictability.
Okay, so then now she's going to basically transition to Clover Health. I like what she's doing. This, she's very tactful on this. She's very experienced. She's just like I think I'm starting to have a crush on her. Okay, so all right, listen. So she's going to go ahead and she's switching now, and she's saying, with all these things, and she's pretty much set out the problem, set out the thesis, and set this beautiful paper written. You could just publish this, right? Then she's saying that we need help. We need money. You need to support this, right? There needs to be some money, because ultimately it's going to, you have to invest in order to get tax, in order to get tax savings. That's how it works. You can't cut. You cut, you're going to spend more money on X, Y, and Z. And then she goes ahead and she basically pivots now. And she talks about, in fact, let me just go ahead and replay it, because this is a really good pivot.
But despite these successes, significant challenges remain, namely those of investment, administrative burden, and lack of predictability.
Okay, lack of predictability. She's attacking the ACO REACH program. The ACO REACH program was unfortunate. It's just that non-insurance side needs to get fixed. They have someone on the inside, Mr. Greek. Mr. Greek is going to hopefully get on the inside and hopefully fix the ACO so that the machine learning models are able to predict. And here's the thing. If the ACO becomes profitable, if they're going to re-enter that business in the next 2 years, and that's going to be when interest rates go down. If the ACO becomes profitable, holy moly, is the amount of lives under management with Clover is going to go increasingly high. Okay, so that's a big thing. And if they, in order to do that, they need to make the models more predictable. And this is what she's trying to show. These doctors are showing, and guess what? It's not just Dr. Taylor from Clover Health. It's going to be Dr. X or Businessman X from Humana or United Healthcare. These healthcare companies, if you haven't realized, they've been decreasing in terms of stock price. Look at Humana, it's down 35%, a little over possibly. And the reason why is because the costs are increasing, because it's becoming unpredictable, and also that people are becoming more sicker. Listen, guys, listen. No one wants to talk about Clover Health right now. No one is even talking about it. It's a boring company right now. Guys, do you think you make money when no one wants to talk about something, or when everyone wants to talk about something? You can go ahead and buy NVIDIA right now at around $900, or you could have gotten it if you looked at their alstocktrades.com website. We were talking about it when it was $135, right? No one was talking about it when it was 135, right? Or 177. No one was talking about it back then, right? This is where opportunity is meant. You got to go when other people are not going. And if at least I can say, you know what? I'm the only person talking about Clover, but Renaissance Technology is buying Clover, right? So, Jim Simmons, right? So, the thesis is becoming clearer and clearer. And I know the stock price is going down and all this emotional stuff, but I'm not even looking at the stock price anymore. I'm building, I'm building my future, medical life. I'm focusing on other things. You make your money work, and you make your money work. Okay. So you can go out there and build other things. Right. But again, there's a lot of people that are just, very hyper focused on the stock price. And maybe that should say a little bit about your risk tolerance. Perhaps maybe this might not be a good tactic for you. Okay. Let's continue.
Transforming care does require significant investment, which small or rural practices either can't afford or accomplish at their scale. There's just a base cost to personnel, and then the patient and analytic tools that you need are unaffordable for the small practices. But without these important solutions, we don't have the critical information that we need to better care for patients or avoid duplicate services.
Exactly. This is the duplicate services I was talking about, because if they can continue, if Dr. X, let's say from a bigger city, orders X, Y, and Z, and then, the rural doctor orders it again, that's wasteful spend. That's wasteful spending. Also, she attacks rural doctors. I'd say attacks. She focuses on rural doctors. That's really good. She has experience in that, right? Rural medicine is huge, guys, right? The problem is they don't have a lot of resources and they can't afford this. Well, guess what? Clover now is going to be basically hopefully providing this service. And that's why these doctors are probably happy. Remember that video voice recording I told you of that lady? She was so excited. She's like, oh my God, I love Clover. It makes my life easier, right? This is the type of knee-jerk reaction you want when you create a software like this. It takes time, but I do believe they are working in the background. Let's continue.
This is frankly what drew me to my work at Clover, so that we could work with primary care practices and provide them these additional resources so they could serve their patients. In the last several years, providers have experienced a drastic uptick in administrative burden beyond the good medical record keeping that you'd normally expect. There's additional reporting of information that's not impactful to patient care.
Exactly. So let me just go ahead and unpackage this. So when I was working with the family medicine doctor, because I have to, like, he let me leave at 5 p.m. because I have to go study, right? Because I have an exam after the end of the rotation, 2 different types of exams, and he then said, "I just before you leave, I just want you to look at what I have to do." He showed me 3,000 to 4,000 messages he has to respond to, in terms of every time, let's say a patient goes and gets another lab test from another doctor, or let's say every time he was using Epic. Every time he had to essentially go in and a patient goes into the hospital, or patient gets a refill on his prescription, or a patient goes to the urgent care. There's like multiple messages, and he doesn't leave until 11 p.m. He doesn't leave until 11 p.m. Right? This is terrible. This is terrible. And you know what's crazy? He's an 80-year-old doctor. Okay. This is just complete BS, right? The system. And you know what's crazy? He said that these paperworks I have to do, they ultimately don't directly help with patient care. They don't help with patient care. And, so some of them do, but some of them don't. Right. And she's saying that in order, you guys are decreasing our money. Primary care doctors don't make the most. You got to remove the BS of medicine, which is the paperwork. We're not doctors of paperwork. We're doctors of medicine. Okay. We are doctors of diagnosis and treatment. All right. We're doctors of human and compassion and treatment. Okay. That extends beyond the surgeon's knife or the chemist's drug. The issue here is they need to find a way to decrease the burden. But guess what? Clover's doing that. They're going to start doing a dictation software, if you don't realize, from their last Clover Assistant showcase, where the doctor is able to speak, the patient is able to speak, and AI is able to basically parcelate what the patient is saying and what the doctor is saying, because they can see a change in voice, right? And most likely the voice is going to be trained to the doctor, so the doctor knows, so the AI knows that this is X, Y, and Z. And guess what? What's going to end up happening in the future is, once the patient and the doctor talk, then the AI is going to be recording the whole thing, right? And then again, this is patient information, yada, yada, yada. But again, it's being recorded into the insurance company, right? You're already going to give this data to the insurance company anyway. They need it, right? So you're going to go ahead and say this. And then the Clover Assistant, most likely in the future, I speculate, and I do believe I'm going to be correct on this. They did say it. It's going to go ahead and write the HPI for you. And it's going to get to a point where the diagnostic criterions are going to be so damn accurate that it's going to create a successful assessment and plan. And obviously the doctor going through medical school is going to be able to verify that. And it's going to say, yes, this is accurate. No, this is not. And it's going to be a plus or minus fine-tuned probability model system, just like a convoluted neural network, which you should basically Google on your free time, that's able basically to predict what is the likely outcome of something. Okay. So I do have some experience in artificial intelligence, and I do research in AI. So I have some understanding in this area as well. You can look at my Google Scholar and you can see all the publications I had for that. All right, let's continue.
And this burden is definitely heavier on the primary care physician. We're taking precious time away from patient care duties. Intentionally or not, we are adding strain to a shrinking primary care workforce. We must decrease the administrative burdens that are not directly impacting care. And finally, we need more predictability. Frequent changes in federal requirements and unstable payment arrangements are challenging for all providers.
She basically attacks the government here and says, you know what, dude, can you stop changing your bullshit? Can you please stop changing? Like, this is enough. You keep changing it, and it's causing unpredictability, and this is going to cause effect on healthcare. By the way, just a shout out to Brandon. We use this type of tech at work. It's awesome stuff, creating transcripts for each speaker in a single recording. Exactly. I believe Otter is doing it, and all these other ones. This is very good. And if you look at the recording for ChatGPT on your phone, the accuracy of it being able to dictate what you're saying, holy crap, guys, this thing's accurate. Okay. And a very good shout out to Spotless Enterprise. Yeah, guys, if you do find value in this video, please give it a like. It doesn't cost you. It's just a click for you guys, but it really means a lot to me, and it really helps out the channel, and it helps spread this video out. Because, guys, listen, Clover Health needs all the help it can get. And, I know there's a lot of doctors that watch our video, so this will definitely help it get out to more doctors, okay? All right, let's continue.
More so the smaller ones. In order for practices to be able to move to value and provide coordination beyond traditional care, we need predictable and sustainable reimbursement models. In summary, primary care providers are the front line of coordinating care. Patients who see primary care physicians are healthier and at a lower cost. We need to assist the primary care providers to enter and remain in value-based programs. Thank you very much.
All right, ladies and gentlemen, let me go ahead and remove this, stop the screen share, and go back to the normal screen share. Okay, so now that we did that, so this pretty much goes over this whole testimony here. So this pretty much basically, she reads off of this in essence. If you guys want to go ahead and you guys can, find it online here. It's simple. I think it's on our stock terminal too. So we went ahead and did this. Now, let's go ahead and just let's focus a little bit more on Dr. Taylor. Okay. So here is the Iowa Medical Society, and here she is. She is the president-elect, and guess what? She's a CMO, Clover Health Value-Based Care. And it's actually really good. It's advertising to all these MDs out there that are looking, all the MDs in Iowa. This is going to cause and help these Iowan doctors to say, you know what, I trust in Dr. Taylor. If Dr. Taylor says X, Y, and Z, then I'm going to basically, try to, maybe I should buy this for my own private practice, right? Just like how they buy Epic or whatever. They're going to make business decisions to ultimately save X, Y, and Z. So I am very, I'm very confident in this endeavor. Okay. And ultimately, this is going to be to a point now where, is it morally wrong if a physician recommends an insurance company? Well, if a physician is not being paid by stock options or is not part of the company, well, I think if the papers that Clover publishes that suggests that, patients have higher medication adherence, decreases in aberrations in hemoglobin A1C in terms of a tighter glucose control, as well as a stabilization within their glomerular filtration rate. I would honestly love to have some of these academic doctors. I don't think there's academic doctors here. Academic doctors are doctors like what I'm trying to be, where I'm going to be, I'm a researcher as well. So I like to create things and create new treatment plans and push the field of medicine. A lot of these doctors are rural areas. So it would be nice if an academic physician can take this on and to really analyze this data and publish it, because, truly then you would see really true adoption from, but then a lot of these academic centers are run by, like, for example, Banner Health, or like other, institutions that, have their own deals with United Healthcare and Humana. Again, hopefully Clover can get into that position. Okay. So now we talked about this. Let's go ahead and talk about this gentleman here. So this gentleman is obvious. So he is a Republican from Iowa. And this just shows you the bipartisan reach of Clover. We have, Chelsea Clinton, who's on the board, who's a Democrat, obviously, because her mom is a Democrat and she ran for the Democratic president, and her dad is the Democratic president back in the 90s. And we have this Republican here. This is actually really great, guys, because this shows you that at the end of the day, we all die. At the end of the day, we all get sick. There is no red and blue sickness, right? There's sickness, complete sickness, right? So it's good that we're all coming together on this and really tackling this issue. And it really makes me, be hopeful about the future of healthcare in this country. Okay, so now let's go ahead and talk about the industry veteran Clay Thornton joins Clover Health. We already talked about this. The biggest thing that I want to talk about here is that right here. So Thornton with an impressive track record. Yeah, I don't care. Here it is. This is all you need to know. Okay. Targeting adjusted EBITDA profitability for the full year 2024. Good. That sounds great. Also, another one is he's notable for leading a $3 billion revenue business. So he's obviously, I'm just going to tell you guys this right now. It's taken me about 10 years to build my nonprofit food program where we distributed millions of pounds of fresh produce. But guess what? It's now that I'm the CEO of Global Neurosurgical Alliance, we have over 300 members. And what I've accomplished in 10 years, I actually accomplished in 6 months. So I think he'll be able to accomplish this a lot sooner, right? All right, guys. So that's all I have for you guys here. So then there's that. Let me go ahead and go over the questions real quick. How you doing, Coach Brian? And then good. Everyone like the video. Thank you. All right, guys. So that's hopefully a wrap for this. If you guys like the video, please give it a thumbs up. And if you haven't done so, subscribe. Also, check out our top selling best book, Intelligent Investor for the Modern Reader. And How to Find the Next 10 Bagger. And for doctors, this is a great book for physicians. Again, all profit proceeds. These two will go to the Global Neurosurgical Alliance. This book will go to the Neurosurgery Research Education Foundation, which is a big nonprofit that helps cure and try to find cures for diseases of all different types that are neurological. All right, guys, I hope this video was pleasantful, and I hope you have a wonderful weekend. I can't wait to see what the earnings are going to be next week. I think I'm not really too confident in the earnings for Q4, but I am confident for the guidance. So we'll see what happens, okay? And the biggest thing is, and they're not probably going to release this guidance until next year's guidance, but what happens to the STAR decreases in 2025? How are they going to affect Clover ultimately? All right, just for that year, though, okay? And how's it going to affect EBITDA, adjusted EBITDA profitability when they go down to 3-star ratings? Hopefully this makes sense. I will see you on the next one.